You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hello, everybody. Stellar Success Podcast again. Glad to be with us. I have a great guest today, Dr. Arnold, who will tell us a lot about mixing medicine and business. How are you, Dr. Arnold?
I'm fantastic. Thank you for having me.
Sure. I want to start with a very simple question that's gonna get rolling here. What is success for you, and why do you do what you're doing right now?
Wow, you really start with a good one, don't you? I think to me, in order to know what success is, I have to know obviously what my goals are. So, my goal in entering medicine has been to help people. So that always has to be at the center of what I'm wanting to do. I also want job satisfaction. I want to know at the end of the day that I feel satisfied with what I've done. And then I also want to have a life outside of my job. So I think balancing those three is what success means to me.
Very nice. Very nice. Can you tell us a little bit about your story when you start, what you're going through, and where are you now?
Yeah, of course. I was kind of a non-traditional candidate. So I had a couple jobs before I went to med school, and then went to medical school thinking I would be a pediatrician. I went to my OB rotation and loved it, and then went to my peds rotation and did not love it. And so I had to kind of grovel back and say, y'all were right. I did love this rotation. I want to do OB-GYN. And at the same time, I, through previous jobs, ended up adopting my 3 kids. And so all of that happened within the same year. And to make all of that work together, from California, I moved to Oklahoma to do my OB-GYN residency. I knew that I couldn't afford coastal life as a resident with 3 kids. So I went to Oklahoma. I think it is so important for everyone to have lived in blue and red states, no matter what your politics are, because I think understanding where people come from is incredibly important. So I did my residency at OU and then stayed in academics for a couple years after residency. Then I transitioned to being a director of women's health at a large federally qualified health center. I loved that job. It, in terms of success, it gave me pretty much all the factors. I got to help people. I loved my job. I got to come home and spend time with my family. Ultimately, unfortunately, politics in Oklahoma made practicing medicine challenging, and so we decided to move. So I've been back in Washington, D.C., which is actually where I did my medical school training, for almost a year and a half. And in that transition, I really did transition. I transitioned to working as a laborist and then trying my hand at startup companies. I was able to get my MBA while COVID was happening. I did an online MBA program that was sanctioned through our medical society. And so I decided to transition. And so that's where I am right now.
Very interesting. So you not only travel the states with your medical practice and educating yourself, but you started something that a lot of people are afraid of, to start a business with this fast into their medical career. And you got your MBA already. Tell us a little bit more about why did you do it, and what did it take for you to switch or add this business financial aspect to your career?
I initially got my MBA because as I was kind of working my way up in leadership, I had more and more exposure to communicate with C-suite people at my institution. And I felt like with my medical training, even if I had a good idea, I couldn't communicate it with the right vocabulary so that the C-suite people thought that it made sense. I had ideas, if you think about like group prenatal care, that generally makes a lot of financial sense, having a lot of women in one room and getting to charge for that. But I wasn't able to write up proposals that communicated that. So that was ultimately why I decided to get my MBA. And my MBA was focused in healthcare administration. So I found the courses really interesting and all things that I wish I had known for a lot longer. And ultimately, I think, I come from a family of artists. Everybody in my family, they're writers, they're photographers, they work in musical theater. And when I'm with my family, I'm like the uptight type A person. And then when I go hang out with a bunch of doctors, I'm all of a sudden the like loosey-goosey kind of creative type B person. So I think I probably fall somewhere that's pretty normal, but tend to hang out with both ends of the spectrum. I mentioned that because ultimately I think in medicine I missed that ability to be creative and take risks. I think strangely, you get some of that in surgery. You know, there's so many different ways to complete a surgery, and so that is creative, but I miss that risk-taking ability, and that risk-taking ability is, you know, never something I would undertake when somebody's life is at stake. And so getting to do it with, you know, small amounts of money where you can just kind of see how it goes has been really fun for me.
That's very interesting. That's very interesting for someone who wants to step into your footsteps, basically. And I would love to know, for our audience, what would you advise someone who just graduated from residency and wants to practice a specialty, in terms of like branching out into the business world or getting an MBA? How would that help? And how did that help you personally in venturing into startups?
I think ultimately you don't have to have your MBA. I think probably I personally got my MBA because I had already been out of residency a little bit and I was used to walking in and being like the expert in the room. You know, once you've been in medicine for a little while, when you walk in a room, you're the attending, you're supposed to know what's next and you're supposed to kind of take charge. I think if you are just out of training, you're interested in getting into medicine, you probably don't need it because you can probably walk into a room in a much more humble position and say, hey, I'm a doctor, but I don't know that business lingo. Like some people are really comfortable walking in and saying, I don't know that abbreviation. Would you mind explaining it to me? And for me, I wanted to know more than that walking into the room. So I think some of it is just personality differences. I think speaking to founders, to people who are starting their startup companies, their dream is to know what the problems in healthcare are. They want doctors to come forward and say, here's a problem I encounter 16 times a day that doesn't have a solution, because we're the only ones who know that. And so if we as doctors are not speaking out about where the issues are, then honestly, it kind of puts us in the spot of being complacent. That's how we're viewed because we know the problems and we're not being a voice to fix them. So to me, that's what doctors can bring. When you're looking around, try not to get complacent with the status quo of like, oh, I don't have a solution for that patient, or I don't, this is how I do it. This is the workaround. Try to really look at it and say, like, gosh, that's a space for a new product or a new technology or something like that, because that's where you can truly make a difference.
Yeah. In the same time, I think a lot of people are worried about startups in general, especially medical startups. The failure rate is very high.
It's astronomical. I think it's above 90%. Yeah.
Correct. So with your expertise in business right now and your medical training, how would you select a startup, a medical startup, based on what kind of criteria and what are you looking for to have a successful one?
Well, I think that's a great question. I also think that part of what's refreshing, again, about being in startups as opposed to medicine is that people in business are used to failing. Like, it's okay. You oftentimes do fail with your first 2 to 3 companies, and so I think first off, you never sink all of your kind of professional image or all of your money into one startup, right? You have to work your hardest, have grit, fight for it, but you have to know that that might not be the one that succeeds. Oftentimes when I meet with founders, I'm shocked at how they're just like, like first I was in this, then I was in this, then I was in this. This is like my 4th startup and here's what's happening. And maybe that's their successful one. So I think you have to have a different attitude towards failure than almost anyone in medicine I know does. You have to accept that failure might happen. But in terms of your question of what to look at to find a successful one, I think you want someone who has experienced the problem, yes, but then you need a solution that is clinically accurate and that actually fits into medical practice. To me, those are incredibly important. And then lastly, I really think you have to have an eye on health equity. And so to go through those a little bit, like utility would be like, as an OB-GYN, I used to have patients all the time bring in these period tracker apps. And they will tell me, like, I've been logging when I had spotting, I've been logging when I was having sex, I've been logging when I was bleeding. And I look at it and I cannot get any useful information out of it. And this patient's been sitting there logging it every day for like 3 months. And we're both in that experience incredibly frustrated. So that would be usability, like that app should have some kind of interface that a physician can look at and go, oh, your cycle is 30 days long and your period is 5 days long and you were having intercourse at the right time. So I'm not sure why you're not getting pregnant. Like I should be able to see all that immediately. So that would be kind of the utility issue. Clinical accuracy is a huge problem. I mean, more than 80% of apps don't meet clinical accuracy criteria. So then we have patients out there who are trying to learn and are being fed politically inaccurate information. So that's huge. And then lastly, health equity. So many startups in medicine, because of financial reasons, they start out just catering to self-pay patients, right? Which is going to be like the upper socioeconomic status patients. And then when they get their first big contract, sometimes it's from Medicaid, sometimes it's from a private payer, they don't tailor their product to go from this high health literacy, high access patient population to go to a different patient population with less resources. And so I think having health equity consultants involved is incredibly important for success because it lets you actually scale up and out from that upper socioeconomic status where startups typically start.
I see. You said something very interesting about the apps that are clinically inefficient, I would say. And I can but think about, you know, my early years of training where everything, we didn't have internet, we didn't have apps. We had a patient in front of us and we managed everything clinically by exam, by physical exam. And now I feel like everything goes towards technology taking over the human touch. And I want to see how you balance those things, because I feel like a good medical doctor should be trained in a great physical exam skills for a patient. But unfortunately, very few people do it anymore. So we rely on a lot of technology, a lot of tests, a lot of CAT scans and MRIs and apps for that reason. But we tend to forget we have a patient, a human being in front of us. In your medical practice right now, how do you balance those things?
I share your concerns. I mean, I think unfortunately liability plays such a large role in how we practice medicine now. You see everybody practicing defensive medicine. I was, trained in a similar manner where I got hammered into my head that 80% of what you need to get a diagnosis is in the history and physical, and you order your tests to confirm them. And there's very few people who practice medicine like that at this point. I will say with the apps, I view it as a separate entity from testing. I view it honestly as a way to take a better history, because oftentimes when I speak to a patient, they're using such different language. So to give a OB-GYN example, a patient will come in and say, I get 2 periods a month. And in my mind as an OB-GYN, I'm thinking, well, she probably gets a period every 2 weeks because that's about what you need to get a period twice a month. And in her mind, what she means a lot of the times is that she gets a period every 22 weeks. So if she gets a period at the beginning of the month, by the end of the month, she's had a second period. And technically that's normal, but it can take us a long time of kind of like going back and forth with what's happening. And so to me, I view these apps that are tracking things as just a better, more accurate way to take a history, because the patient is putting it in the moment. It's not so much the technology or taking away that human touch that's happening to the way that I think about it. It's more that it's taking a history in the moment every day so that I get a really accurate picture of what's happening.
Yeah, that makes sense. I mean, obviously for tracking purposes, those things are really great, and everybody these days have a phone.
Yeah, we're seeing it be really useful in a lot of chronic syndromes. So if you look at patients with like IBS, it's incredibly handy to have them tracking things like that every day, even chronic pelvic pain, infertility, and again, just typical irregular bleeding with periods. It's incredibly useful to have them enter data every day.
Yeah. I want to dive in a little bit into your personal success. And you're a mother, you're a physician, you're a business person. How do you manage all these things in a day? What does a day look like for you? And what kind of skills and habits do you incorporate to be this successful?
I would say that I try to really focus at the beginning of every day of what I need to do that day. And that sounds so rudimentary, but I think it's so easy to get sucked into just what somebody emailed you to do that morning, or, the top of your inbox. And I think really thinking strategically about, my priorities. So right now, like you said, I have kids. Those are a lot of logistics. I love them. They're also a lot of logistics. I have a medical device startup company that I work with. We're trying to get that out to providers right now. So I have a lot of goals with that. I have Fem Innovation, which we're focused on helping femtech startups. And then I have my clinical work. And so I really try to focus on like that week, what things do I need to move forward in each one of those areas? And I try to really work off of that checklist, as opposed to answering exactly who's calling in the moment or answering emails as they come in, because to me, that's what actually keeps my mental health sane, is knowing I'm checking off the goals that I needed to. I'm actually making progress this week, as opposed to my inbox is empty, but I forgot to, actually move a project forward.
Yeah, definitely. So tell us a little bit about your projects right now. You mentioned a couple of things. What's going on and how far are you on those business enterprises?
Yeah, I'd love to. So this is the Yoni Fit device. This is a device that's designed by our CEO, Allison Watkins. It's an intravaginal device that treats stress urinary incontinence. So when women cough, laugh, or sneeze and they leak, this treats that. It looks like a menstrual cup, but it has a crosshatch in the middle here that actually puts more pressure on the anterior vagina so that they don't leak. So it's really exciting. Other options for patients would be like pessaries, which are really firm rubber intravaginal devices that are much harder for the patient to have access to, harder to put in and remove, or surgery. And so a lot of moms who just say like, hey, ever since I had a baby, I can't go to my CrossFit class, or I can't chase the kid without leaking. This is a great solution for them. So it's FDA approved. Now we're getting it out to providers to prescribe it. So it's really exciting times for this. So that's one thing I'm doing. And then the other thing I'm doing is called Feminovation, and it's a company that I co-founded with an attorney named Bethany Corbin. And we kind of have two areas we're focused on. One is training clinicians. So clinicians who want to be involved in femtech, really our course is aimed that you don't have to go get your MBA. You can do our 8-week online course that goes through a little bit of kind of the logistics of startups, stages of funding, important kind of lingo and abbreviations, because that's an easy way to feel lost at the beginning, and then roles for clinicians. And so by the end of all of it, clinicians come out of it with a good idea of what role they want to take in a startup. And so far, our clinicians all have roles in startups after completing the course. So that's really exciting. And then we're also now getting into helping connect consumers and clinicians to investment opportunities in startups. And to me, that mentality is almost like how you talk to patients about a clinical trial, that you say, like, I'm sorry, your options for treatment of XYZ, endometriosis, stress urinary incontinence, whatever it is, were not ideal for you. These are the companies that are trying to make it better for the future. If you want to invest in them, there's a good chance that, people in the future with this problem will have better options. So that's what I'm working on. It's a good balance. I'm really enjoying it. I'm learning a ton. I think as physicians, we all love learning, and it kind of unfortunately plateaus out as you've been in practice for a long time. You start to practice off of pattern recognition. And I think that's where a lot of burnout comes from. And so with these things, I get to still practice clinically as a hospitalist, but I get to try new things and learn on the go every day.
Yeah, that sounds very exciting.
It is.
And you mentioned those two business enterprises you're involved in, and I'm thinking there's very much talk within physician community about burnout and retiring early and having some kind of passive income to get you going after you want to scale back. Do you have any thoughts on that? Do you have any enterprises that you're thinking about those types of income, or any planning?
I mean, that's the dream. We talked about the high failure rate. So, to me, startups are not kind of a get rich quick thing. I do think they are a really, really good solution for burnout. I think when we look at the factors of burnout, so much of it is control. We as physicians have lost so much control. I know you're in independent practice, so you're a bit of a unicorn that you have maintained your control. But, we're in hospital practices now. There's not control over your schedule. There's not control over your patient population. There's just so little control physicians have. There's so little ability to be creative, to take care of patients in new and innovative ways, because it doesn't get paid for, or it's not part of, the workflow. And so there's just all these pressures. And I think when you get into a startup and everybody's kind of like, well, why is it like that? And how could it be different? And do you think this would be easier than this? That kind of conversation is, not to overstate it, but truly life-giving as a physician, because you just haven't been able to use that part of your brain and think about, like, oh, maybe that, like, to use an example from the media right now, maybe that IUD placement wasn't great. Like, maybe that was too much pain for that patient to go through. And just because I've always placed an IUD without anesthesia, maybe that's not how we should keep doing it. How could we do it differently? Like what might work for anesthesia for an IUD? How can we make it less painful? All those kinds of things. And so I think, to me, it may help financially. There's, ways for you to be more focused on financial benefits. You can take smaller roles in more established companies, and that typically is going to be a better financial payout. But you also don't have that kind of freewheeling camaraderie brainstorming that I was just mentioning, because they're going to be further down the process, more things are already in place. And so that may be a better option for people who are wanting to do it more for immediate kind of financial reward. But I've seen a good amount of physicians actually become happier in their current roles by taking up on startup roles. So it may not be that it replaces your income, but it may be that by doing something like a startup where you're improving healthcare and getting to think creatively, you may actually be happier in the job you already have in addition.
Yeah, definitely. I think so too. And I feel like a lot of people in our profession are now, in majority of them, employees, right? They're employed by the
Yeah,
hospitals,
exactly.
they're employed by the groups, and they have a set schedule. They don't have
Yep.
the options of going back and forth with their control and time.
Yep.
And this could be one of the things that can excite them. They can, branch out in their free time and get them, more business savvy, I would say, in their own jobs. And I think that's a win-win situation here. And I think more people should do or think about doing this or partner with somebody who does it.
Exactly.
And, I think one of the main, like you said, the main important skills of somebody who does that is getting out of their comfort zones and and think a little bit about risk. How do you approach risk in general? Because it seems like you go into startups, which is a very like risky business proposal.
Yeah, it definitely is. When my wife and I first got married, we went to a financial advisor and they had us take one of these quizzes that's like, you have $20, here's your chance of winning $100. Do you bet it all? Do you bet half? Do you bet none? And at the end of it, hers popped up like no risk, like put the money under a mattress, and mine popped up like all risk, like bet it all. Let's see what happens. And so, I grew up in Silicon Valley in the dot-com boom. So I grew up with this kind of like
Your
belief that,
virus.
and yeah, I'm like, any startup can succeed. You never know, it might be the next, Apple computer, who knows? And so I really, really enjoy taking risks. I also, have a family and a mortgage. And so the balance for me of being a laborist and of getting to go to work, know that I'm going to make enough money to take care of my family, everybody's going to have health insurance, and then that the rest of it is like great if it works out, but okay if it doesn't, is a really good place for me to be mentally, because it lets me go about this kind of brainstorming in a positive light, as opposed to like a fearful light of this has to work, otherwise we don't have any food or something like that.
Yeah.
So I think being able to take risks in a way that doesn't impact my family's stability has been just incredible for me.
Yeah, very interesting. Like they said, you miss 100% of the shots you don't take. So you have to
So
take some
true.
shots at some point
Yeah.
in life. And, I think Chris Williamson said something similar to, to get something you never had, you have to do something you never did.
It's true.
So
And I do
it's a
believe,
branch out kind of a mindset that you need to try something else in order to be successful.
yeah. And I do think there's a lot of learning that happens in failure. And in medicine, we almost never get to fail. Nobody wants a doctor who wanders around failing. That's not going to go well for anyone. And so I think in this kind of like, we all trained in this perfectionist mentality. And so to step away from that perfectionist mentality and go like, well, this might fail. We'll see, this idea or even this company might fail. But being willing to take the shot still, I think, is really good for mental health. And I think it's good for kids to see too, like kids fail all the time. Maybe it's okay for them to watch me fail. Like it's hard
That's
to
a
tell
good
your
point.
kid over and over again it's okay to fail. And meanwhile, I'm supposed to have 100% success rate at work.
Yes, it doesn't work like that. In life in general, it's a lot more failure than success, to be honest.
And that's
Uh,
where you learn.
yes, and you cannot have success without having a failure, or somewhere along the way to learn from.
No, I've already failed
But
lots of times in a year and a half or however long I've been doing this. I've definitely failed lots of times and gone like, oh, well, that doesn't work. I won't do that again.
yeah, that's true. Do you have any kind of advice for someone who would uh, want to start a medical company?
Someone who's in medicine who wants to start a medical company?
Yes.
Yes, I would say, I always kind of joke when I'm partnering with people who are business trained, that thank God for them, because people in medicine never do anything with their ideas. And unfortunately, that tends to be true. I've met so many doctors who come to me and they say, "Oh my God, I've had this idea for so long," and it doesn't happen. And, there's good reason for that. We don't have the business training. We have huge careers and lives and all that. And so my number one advice, in all honesty, is to find a co-founder. You need a co-founder that you're going to work well with, who directly complements your skills. Don't pick another doctor. Pick someone whose skill set is totally different. Pick someone you're going to work well together with. Lay out everything at the beginning in terms of work, equity, lay it all out. Be honest about how much time you can devote. So you go to a co-founder and you say, "Hey, I can do 5-10 hours a week, whatever it is. And that's what I can put in." And, if you're putting in any startup money, sometimes you have to put in a little money to start up, and be honest about what you're going to put in for that. And then try. And, for some of my stuff, like for Feminovation, we've even said, like, we're going to try this business plan for a year, and we're not going to pivot until we've given it a year. And then we'll kind of recollect and see what's going well and see what's not going well. But my number one would be get a co-founder who is not a doctor, because you need that complement of skills and that person to hold you accountable to move the vision on, because doctors notoriously, we can't move things on because our lives are so busy.
Yeah, that's a great point, especially for the fact that, we tend to partner with people that have the same qualities or vision
Yes.
like us, and that's not always helpful.
No.
We need to realize your own shortcomings, I would say, and look for someone who can do the thing that you cannot do. Like you said, you're the medical idea maybe, or medical expertise in that startup, but you need someone with business skills to move it forward. And people forget
Or even
so quickly that everything around us started with a small garage company in some form, like maybe not garage, but kitchen, or, basement, or something like that. Somebody who had an idea and moved it forward slowly, and from nothing, and became, an Apple, became a Microsoft, became an Amazon, just to give the bigger examples. But I'm sure, there's plenty of examples in medicine like that. And I wish your company to be one of them, actually.
Thank you. Well, we'd love to have anybody who's interested, come join us on Feminovation. We'd love to have so many more clinicians involved in these medical startups, because it will truly benefit everyone, patients, providers, the healthcare system as a whole. The more that we're involved, the more that the products will be usable in clinics, and then the more they'll be clinically accurate. So it's really important.
Absolutely. I was about to ask you, how can someone reach out to you for advice or for more information in what you're doing?
LinkedIn is probably the best way. They can find me, just Kate Arnold at LinkedIn. You can message me. Feminovation.com has all the information about how to get started with investing and how to take our course. And then if you're interested in Yoni Fit, just reach out to me on LinkedIn too. I can get in touch with you. But for anyone who's considering venturing into this world of startups, I really encourage you to do so. I think it's given me a lot more job satisfaction.
Yeah, I definitely kind of second you on this, because I personally am invested in 2 startup companies, medical startup companies, that I like, and I hope to move them forward. But it's something more, like you said, it's more like a side project for me to be an investor in, rather than take the lead. But there's so many people out there with great ideas that they don't want to believe in themselves, and they need a push from either a business person or someone like you who had a little bit of experience of doing this, and say, "Hey, why don't you put that idea forward and see what you can do with it."
And founders, so many founders are patients who were dissatisfied with some aspect of medical care, and then they decide to go fix it, which already we're behind the 8 ball a little bit, because they're frustrated that doctors didn't decide to fix it first, because we've seen the problem. But if someone like that comes to you and you listen to them as a clinician and try to help them move it forward, they are just incredibly receptive and grateful. It is just it's the start of a great relationship if you can do that. If you can work with a founder and help and believe in their product, to me, it's an incredibly rewarding relationship.
Excellent. Well, Dr. Arnold, thank you very much for coming over. I hope a lot of people will learn from this podcast, and hopefully, get a nudge to move them forward with their ideas.
Thank you for
That's my
having me.
hope.
It's really exciting.
Sure, absolutely. Hope you have a great success with your enterprises, and maybe we'll circle back later on to see how your companies are doing.
You as well. Thank you.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.